If you can believe it, it was in 1925 that the father of science fiction and the namesake for the Hugo Awards, Hugo Gernsback, envisioned my favorite form of futurist telemedicine, the teledactyl. It used radio and television technology so that a physician could be miles away from a patient. And with the patient was a machine that was equipped with heat and pressure-sensitive fingers that was guided by the physician, and that did the exam. So tele, meaning far or distant, or dactyl, meaning finger, teledactyl is actually incredibly clever. And if you fast forward to today, Mr. Gernsback wasn't too far off the mark. Telemedicine is here today, and the tools are mind-boggling. But what's missing from the telemedicine equation is not the tools. What's missing is you. Each and every one of you individually. I am here today to tell you that you can shape the future of worldwide care. But first, we have to zoom out for a little context. You'd have to be under a pretty big rock to not know that the future of healthcare, at least fiscally, is, we'll just call it dire. In fact, overwhelming. And if you're feeling a little overwhelmed, so are many of our policymakers. Delaware's Governor John Carney, in the last round of budget negotiations, said healthcare cost inflation was the #1 challenge facing national and state budgets. In our own little state of Delaware, we are 5th in the nation per capita for healthcare spending, and yet by many measures, we are 31st for outcomes. And in everybody's personal households, our insurance premiums rise way faster than we get raises, and this is the story just about everywhere. So I don't know about you, but that makes me feel a little powerless, a lot like the people on top of this bus. A bus that's a little worse for wear and on a road that's clearly not much better. And this bus is going faster, and these cliffs are getting higher and higher. And nobody's helped by the fact that inside of this bus, every 2 turns of this road, the people inside are fighting over whose turn it is to steer. And so they're hanging on, and we're hanging on. But thankfully, we can get another handhold, telemedicine. So telemedicine goes by a couple different names: mHealth, eHealth, telehealth. They all mean essentially the same thing. They mean the remote delivery of care using telecommunications technology. The remote delivery of care using telecommunications technology. So it's not a scary new type of medicine. It's a new way to deliver existing medicine. And so knowing from our definition just now that telemedicine means remote care, and from teledactyl that tele means far or distant, it probably doesn't surprise you at all that some of our first telemedicine patients were our most distant, our Arctic explorers, our astronauts. When Neil Armstrong was walking on the moon, his EKG was printing out in Houston. It was incredible. And we have incredible people here today. But I imagine we're a little short on astronauts and we're a little short on Arctic explorers. But I did tell you that you could shape the future of worldwide care. And you can. But collectively, we need to first take this idea of geography as this measure of telemedicine and just throw it out. In its place, think of barriers. So we all have barriers in our lives. They are incredibly common. So think of Doris, retired on the beach, but she has Alzheimer's or Parkinson's and she can't drive. Or think about the young couple. Both have very demanding jobs and they've just sent little Isaac to daycare, but it seems like every other day Isaac is coming back to them with a new plague. And so when they are out of sick days and they're already late for work, that pediatrician may be as close as just a few blocks away, but to them, that pediatrician is basically on the moon. And these are cost drivers. All of these barriers add up to a system of sick care where we spend 80% of our healthcare dollars on 20% of our population. And if we can shift some of that attention, some of that 80% of resources to that 20% of people using telemedicine, we can catch their stage 4 cancer when it's stage 1 or even stage 0. And that means that we can catch it not only when it's more curable, but pragmatically, it's also much less expensive. So thinking about our definition of telemedicine and the rethinking of it, my first stop as a millennial was Google Images, and it was way ahead of me. So forget the stars. Instead, think of a computer, think of your smartphone, and pair it with the classic example of a health symbol, the stethoscope. And really, this is what you're going to be thinking about and seeing as you get into this world of telemedicine. These tools now would blow Hugo Gernsback's mind. Thanks to almost $4.4 billion a year on average being spent on telemedicine technology over the last 3 years, these tools are getting smarter, they're getting slicker, they're getting more affordable, and therefore they're getting more accessible, which means that they are revolutionizing certain areas of care. For instance, think about home health monitoring. Remember Doris? Doris down at the beach, she has what's called a chronic condition. That means that she often has to travel for these batteries of tests, these tests that she has a lot of trouble getting to. And if we could remove that barrier using telecommunications technology, this home health monitoring, so that Doris can get this battery of tests done in her own living room, how much easier her life would be. And that just really is the tip of the iceberg. It really gets my mind going. Think about your own lives. Think about when you see your primary care doctor and they said that you have to go see a specialist, maybe a therapist, and you know that that's going to mean weeks later, a whole nother location. And if you could instead see that specialist right on the spot from that very visit with your primary care doctor, how much easier it would be. And think about whole populations of people that we bury on purpose, our prisoners. If we were able to get them re-entry care that they need, think about addiction services, how much better that would be for recidivism. And think about our most expensive care. Think about our emergency system. It's really driving up costs everywhere. And if we could triage people so they don't go right into that really expensive emergency care, but instead first we're seen via telemedicine with primary care, we could divert a lot of those patients away and really start to drive down these costs. The potential is truly astounding. And so where does Delaware fit into all of this? So if you're not fortunate enough to be one of the 950,000 of us here in Delaware, that's okay. You're still in the right place, I promise you. Just consider this a case study, a way that you can take it back to your community. In fact, I'm counting on you to take it back to your community, because maybe you can beat us there, but we've got a lot of good things going for us. So we are a small state, but we have these nation-sized challenges, this gray wave of retirees down at the beaches, and they have high needs for services, but we have some of the fastest broadband in the country, and we also have a very tight-knit network of clinicians and physicians that we can very quickly show that proactively removing barriers from people's lives will drive down these costs. We also have some of the best laws. So I was thrilled and honored to be able to work on these laws on behalf of the Delaware Telehealth Coalition and also the Medical Society of Delaware. And thanks to some phenomenal leadership from Representative Brian Short, and she was senator then, but now she's Lieutenant Governor Bethany Hall-Long. In 2015, our Governor Jack Markell signed into effect our telemedicine law. And it did a whole bunch of things, but really two that are very important. First, patient safety. Patient safety is always paramount. Telemedicine is not perfect for everything. We can't yet do surgery through a smartphone, maybe someday. But until then, we have to make sure that all care provided is appropriate and safe, and it meets the standard of care. Second, it makes sure that we create this payment parity. And what parity means is that if a service is being able to be delivered via telemedicine, via physician, to that same standard of care as though it were in person, that insurance pays that same rate. That's parity. And this is really important because if there is any sort of discrepancy, it would create a disincentive for the adoption of telemedicine. So we have a lot of things going for us in Delaware. The table is set. And so many of us have actually already received cards in the mail from our employer. I know that my wife did. And nationally, these ads are going up on television that basically say, if you're sick, contact this telemedicine service and they'll square you away. And there's nothing inherently wrong with those. If you have a sinus infection and you want to be seen right away, any one of us at this very moment could spend about $40 and we could sign into one of these services and be seen on the spot. And that's fine, but really what's missing and what Delaware can prove is what's called continuity of care. That it's not just about seeing a doctor, it's about seeing your doctor. Your doctor that knows all 360 degrees of you, that knows all of your challenges, that knows all the specialists to bring into this team that can help you get from your invincible years, your millennial years, let's say, all the way through to your golden years, or to that gray wave. And that's what Delaware can really prove, is that by removing these barriers, we can create this system. And so I'll really leave you with this, because this is where you come back into play. It's as simple as an ask. Ask your physician. Ask your physician next time you are with them. Say, listen, I have some barriers in my life. I would like your help removing them. I'd like you to use telemedicine so I can see you so much easier. And together, collectively, we can show the world what telemedicine can do to the future of health.